Welcome to the Downtown General Hospital. I'm really glad that you all could make it today. I think you will benefit greatly from seeing what is available here for your care. We think that patients and parents who have seen the clinic during one of these tours will feel much more comfortable when the time comes that you have to come here during a crisis. And believe me, you will experience a crisis eventually, and we want you to come in for treatment to a place where the doctors and nurses understand your disease best. Are there any immediate pressing questions that I can answer before we get started?
My child doesn't have health insurance. It seems like that puts them into a different flow in the hospital. How do I make sure that this doesn't impact their health?
That's an excellent question. There's a special department near the entrance to the hospital for patients without insurance. We need to gather more financial information from these people to decide if there is a possibility for extra financial support. People with insurance don't have to visit this department because the insurance company manages all of that information for us. Of course, if there is an emergency, then visiting this office can happen after we've stabilized the patient. Since we're on the topic of emergencies, I tried to orient you around the hospital on the way in, so you would understand the street names, how to find parking, or what directions to give if you are getting a ride from a friend or in a taxi. I also want you to remember that the emergency entrance to this clinic is on the south side. It's different from the main hospital emergency entrance, so even if you aren't taking an ambulance or are driving your child, if it is emergency, you should go straight there.
I am wondering, if my child has Medicaid, how do I know if an emergency visit will be treated differently from a regular visit? Will I have extra bills that will be rejected by the government if I use the emergency entrance too often?
That's a great question. The emergency entrance is designed to be the shortest distance from your car to a hospital bed. The treatment that you get once you get to the bed will be the same no matter what entrance you use to the clinic, and it will be appropriate to the situation. The thing to understand about the emergency entrance is that your car cannot stay there, or it will be towed very quickly. We are very vigilant about keeping that area clear of cars so that ambulances and other patients will have no problems getting to treatment. If your child is being brought in on a gurney and you are the only person that can move the car, you will have to trust us to take care of him or her while you clear the area, or you will have to deal with tickets and fines that will occur if you come inside and wait too long. If you have the time to park your car properly, then you can accompany the patient all the way through the admissions process. That is the main difference.
I also have sickle cell disease, and when I was expecting my first child, that's when I moved to this area. The receptionist in your clinic said that I shouldn't make Dr. Bonafide my primary physician. Why is that?
All excellent questions. When you are pregnant, your baby has to be your first priority, and Dr. Bonafide is not trained in the kind of specialized care that pregnant mothers need. You should refer your obstetrician to Dr. Bonafide so that he can consult with that doctor about how your sickle cell disease affects your pregnancy. Then, after you have a successful childbirth, you can start to come to this clinic as your primary physician again. If there is nothing else, I would like to continue the tour through the ward. You will start by going to one of the exam rooms down this hall so that a nurse can take your vitals. The clinic is currently closed for standard appointments on Fridays, so you have the opportunity to look around all you want. When you come back during normal business hours, you will see that this room and the area in the back here will be busy with patients, nurses, and medical assistants. Even though our examination rooms are on the first floor of the hospital, our patient rooms are here on the 12th floor. This is Chloe, one of our nurses in the clinic. She's been with us for 4 years now. She'll be one of the people coming in to check on you if you ever have to stay at the hospital overnight. Hi everyone. And this is Dr. Thurman. He just joined the clinic a few months ago. He will be continuing the tour with us to hear more about our new and youngest patients. We're so glad that he's joined us because that frees up Dr. Bonafide to spend more time to find research funding for the clinic. We share the 12th floor with the oncology department. We have 2 private rooms on this floor and the rest of the rooms are double occupancy. Getting a private room depends on whether there are already patients in those rooms. Sometimes they are open, but often they aren't. All of the rooms have windows to the outside. So just take some time to look around this room if you want. If you have any questions, let me know. We're going down to the third floor cafeteria next. This is the cafeteria. This cafeteria is open from 6 a.m. until 9 p.m. The cafeteria is really busy during the breakfast hours. If you are staying in one of our rooms during a meal, your meal will be automatically ordered and sent to your room by the nurses on your floor. You only have to request a meal if you're having a visitor that wants to eat with you. If you need coffee or a snack while the cafeteria isn't open, vending machines are in the same place on pretty much every floor. This is Dr. Bonafide. He is the director of the clinic. If you haven't had the opportunity yet, I strongly recommend that you go to his website and look at some of the great publications that he's written. Dr. Bonafide will answer your questions about transitioning to adult care here at the Downtown General Hospital. I'm going to turn it over to him now and go check on the lunch arrangements.
Hi everyone. I'm really glad you all came today to see the hospital. It really makes a big difference to me that sickle cell disease patients feel comfortable coming to our specialized clinic. That's why I work so closely with the pediatricians that you know from when you were kids to do a smooth handover. I'm going to be very frank with you. For some people, this tour of the hospital is a rude awakening. The adult world has different expectations and different priorities. When you were going to your pediatrician, you were surrounded by other kids, playing with toys and surrounded by their parents. Your pediatrician took extra time to ask you about school or about your friends to make you feel more comfortable. Maybe over the past year or two, you've started to feel like the environment of your pediatrician's office was too childish. That's a natural reaction, but everyone appreciates the extra time with doctors and the human contact. The expectations on me as an adult doctor are very different. You will never see an adult doctor like me giving a patient a hug. The other patients and my colleagues would view that as very strange behavior. It doesn't mean that I don't care about you as much. That's just the social expectations of where I work. Children's hospitals get a lot of private support from wealthy donors who get a warm, fuzzy feeling from giving money that will make sick kids more comfortable. People don't get the same feeling from supporting an adult hospital. People typically expect adults to take care of themselves. It's very similar to going from high school to college. The responsibility is transferred to you as an adult, even as a very young adult, to make sure that you are getting the most out of your education and out of your health care. This means that you shouldn't be expecting your parents to ask all the questions. You should ask your own questions. You are entering a period of your life when your pain crises might be increasing. For many sickle cell disease patients, their 20s and 30s are the hardest time in their lives. 30 years ago, the life expectancy for a patient with sickle cell disease was not much beyond their 30s. But today we have much better treatment for you, and I have many patients leading normal lives with life expectancies approaching that of someone without sickle cell disease. So you can expect to get into your 40s, 50s and 60s. What we've seen is that the pain crises come down during this time period. After lunch, you will have the opportunity to talk to some older sickle cell disease patients. These volunteers have been kind enough to come here today to tell you that you need to focus on the same things that healthy young adults focus on. You should get a good education, you should plan on supporting yourself, you should think about having meaningful relationships that will last a long time. Most importantly, you need to take responsibility for your health. None of today's technology can help you if you refuse to own your own treatment. Don't seek care from places like this clinic with expertise in your condition, and especially if you don't tell doctors about your disease. You'll have a chance to hear more from my perspective later today and also next weekend if you come to the transition graduation ceremony. Once again, thank you for coming. You are getting a great start on successful adult care just by coming here today. Are there any questions you would like me to answer before lunch?